Welcome back to this presentation. Today we're talking about nutrition issues in older adults that impact well-being. I'm your host, Dr. Dawn-Elise Snipes. As we age, our body's nutritional needs change. When we're infants, we need different nutrients and we need different amounts, partly because we're smaller. And when we're older, we need different nutrients and different amounts. Without adequate nutrition, our body factory does not function. Nutrition is the building blocks. These are the inputs in our factory that are disassembled and reassembled to make whatever we need, whether it's hormones or neurotransmitters or tissue or neurons or whatever it is. Many older adults have nutrient deficiencies that contribute to inflammation, blood sugar, cognitive, immunity, and mood issues. And we've talked about a lot of that in the previous sections, that as soon as inflammation goes up, blood sugar goes up, cognition goes down, immunity goes down, and mood can go all over the place, but people tend to become more irritable. And one thing I didn't mention earlier, cognition. Not only does inflammation contribute to cognitive issues, but when we are in fight or flight, and I want you to think about a time where you've been scared witless. Were you really thinking clearly? When you were in fight or flight, are you engaging your prefrontal cortex, all those executive functioning areas of your brain? The answer is no. We know from looking at brain scans that when people are in fight or flight, they are trying to survive. They are not engaging higher order thinking. So it makes it more difficult to think clearly, to remember things, etc. Think about a time when you were grieving or traumatized, again, or just really stressed out for some reason. How was your memory? How clearly were you thinking? How quickly were you thinking? Did it take you an extra minute to kind of process stuff? I know for me it does, and it always has. And that's, again, because when we have our fight or flight engaged, even a little bit, it disengages, somewhat proportionally, our executive functioning. Our thinking brain disengages from our emotional brain, if you want to think about it that way. We will explore the changes in nutrient intake and availability in older adults and consequences of those changes and strategies to improve nutrition in older adults. I will say again, I am not a registered dietitian. I am not a medical doctor. Any changes in the diet of your residents or patients needs to be through their medical providers. However, we can educate them about what they need to discuss with their doctor to create an adequate treatment plan. We can educate ourselves so we know what we might need to educate them about. If we recognize that, hey, there may be some nutrient deficiency that might be contributing to this, maybe I should tell Sally about this so she can talk it over with their doctor. It's a little cumbersome, but it's the way it has to be because each person is on different medications. Each person has their own different needs. And just because it seems like somebody is deficient in vitamin B12, for example, doesn't mean they are. There could be 15 other things going on that are causing that same symptom, like hypothyroid or anemia or poor sleep apnea. There's a lot of things. So we need to have them go to their doctor and get an assessment before they start taking steps forward. You can OD on vitamins, even the water-soluble vitamins. You can get too much in your system. You can take too much vitamin B12. Vitamin D is fat-soluble. A, E, those are fat soluble. You definitely can build up to toxic levels of those in your system. More is not always better. It's always the Goldilocks principle. You don't want too little, you don't want too much, you want just right. The other thing we need to remember about nutrients, and I'm going off on a diatribe about supplements right now because so many people think, well, Why don't I just increase my magnesium if I'm having trouble sleeping? No, don't do that. Don't do that. Figure out if you have a magnesium deficiency first. Certain nutrients will argue, if you will fight for absorption. So high levels of magnesium, for example, may suppress the bioavailability of zinc. Well, that creates its own set of issues. If you've got way too much magnesium, then you may not be getting enough zinc, even if you're ingesting it, because it's not getting absorbed. It's all about balance. Whole foods are the best way to get it, because in general, nature has put together these nutrients in a balance that is ideal, in a balance that works. Something's not going to be so high in something in general. Now, you have some foods like stinging nettle. That stinging nettle is super high in vitamin K, but people are probably not going to gorge on stinging nettle. It's one of my favorite vegetables, don't get me wrong, but I'm certainly not going to gorge on it. However, the whole take home from that is discourage people from randomly self-medicating, discourage people from megadosing, especially without a doctor's consent, and encourage people to focus on eating high quality whole foods. Now, when I say whole foods, that can be freeze-dried powders if they can't chew effectively, but look for something that's whole. You don't want broccoli sprout extract. You want broccoli sprout powder or broccoli powder in order to get that whole food benefit. Okay, so I got all off target. Causes of changes in nutrient intake in older adults. Loss of smell. As we get older, our sense of smell gets worse, and our sense of smell takes longer to get from our nose to our brain. Just like every other sensory stimulation takes longer to get from input to process. It's just how it works. Our train has slowed down, and we need to be cognizant of that. So, for example, if you used to be able to really nurture that coffee and you could smell it the minute it started to brew and it smelled so good, and now it's like, part of that could be your sense of smell is starting to go. People who smoke tend to have impaired sense of smell. People with a lot of allergies tend to have an impaired sense of smell. So sense of smell, and if you've ever had a sinus infection and not been able to smell, food, if it tastes like anything at all, it tastes weird. And that, again, is that our brain correlates what we're tasting with what we're smelling, and it puts it together. And if it can't smell, then you're not going to get the whole signal back to where you need it to be. There's a reduction in sweet and salty. Now, aside from just being a cruel joke, a lot of older adults will oversugar and oversalt their food. You can see the problem in that, especially if they're diabetic or hypertensive or sensitive to salt. If they've got, issues like congestive heart failure and they're already taking diuretics, it can be a problem. We need to ideally help educate them and empower them with other spices in order to bring out the sweet and salty. Cinnamon is a great spice, if you will. It's a spice to bring out the sweetness in things. It actually is somewhat sweet itself. And cinnamon helps with blood sugar regulation. Don't overdo it. You actually can get too much cinnamon, but cinnamon can help bring out the flavor a little bit. Salty is a little bit harder, but experiment with other herbs like basil and oregano and parsley and garlic. Oh, I love my garlic. And see if you can find things that make it taste good, even if it doesn't taste exactly the same. Older adults may just not have an appetite. That could be because their circadian rhythms are out of whack, or because they're depressed, or if you can't smell, you're not getting triggered. A lot of us think about Thanksgiving. Thanksgiving's coming up. And I know when I walk into a house and I smell that turkey cooking, my salivary juices start going, my hunger hormones start getting released. I'm like, oh, I can't wait to eat that. It stimulates our desire to eat. Our appetite is stimulated. But if you can't smell and you don't expect to be able to taste, you may just not be all that motivated to eat because eating is not triggering the release of dopamine. People stress eat. We know this. Why do they stress eat? Partly because when we chew, it stimulates the rest and digest, but also because when we eat high fat, high sugar foods, it triggers the release of dopamine and serotonin. So a lot of people, when they stress eat, gravitate towards those highly processed, high fat foods. Stress eating of junk throughout the day can be a habit just out of boredom. It gives them that dopamine release. It gives them a little surge, if you will, from the blood sugar spike. And it can be comforting when people are feeling lonely and isolated. They may gravitate toward foods that make them feel warm and fuzzy, that make them remember good times, like the cinnamon rolls their mama used to make. Aging and stress-related changes in the gut microbiome can make it harder for the gut to break down food and make it harder for the body to absorb it. There is reduced absorption in the gut in older adults. Unfortunately, everything starts to slow down and become more inefficient as we age. Now, we can slow that down a little bit, but we can't stop that process. So we need to recognize that in older adults, a lot of them, especially if they're on medications, have reduced nutrient absorption in the gut. So what they've eaten, what they've broken down, it's kind of going out the other end. And especially if they're not chewing well, if they've got dry mouth, if they've got inflammatory bowel disease, if they've got ulcers, or a variety of things. Monitoring the older adult's nutrition is really important for the multidisciplinary team. There's reduced chewing ability because of pain, because of poorly fitting dentures, because of dry mouth. Difficulty swallowing comes in with dry mouth and with dementia. Unfortunately, as dementia progresses, some people will lose the ability to effectively navigate that chewing and swallowing activity. So they may not be able to get the nutrition in, which obviously is the point where medical staff steps in. But we need to recognize that early because it's not just going to happen one day where you wake up and Sally can't swallow. It's going to happen gradually. And if we notice it, there may be things that we can do to refer them to their physician, an occupational therapist, making changes in their food that can help them continue to ingest food orally for as long as possible. And as we age, just like we have a reduction in sensitivity in our hearing, in our smelling, in our sensory processing, there is a reduction in sensitivity of our thirst receptors. A lot of older adults just don't get thirsty. They're dehydrated, but they don't get thirsty because their thirst receptors are kind of on the fritz. Hypothyroid. As I mentioned in other presentations, a lot of older adults develop hypothyroid, especially after andropause or menopause. Hypothyroidism reduces peristalsis, or the movement of the squeezing of the gut to move the food through it. This leads to constipation. Food just kind of sits there like a rock. When we are constipated and food just sits there and rots, we start having bacterial overgrowth in our small intestine and malabsorption. So we start getting a whole bunch of nasty stuff going on in our gut. Additionally, when people are hypothyroid, they often have low gastric acid. So especially if they've already got dry mouth. So the enzymes that are breaking down the food in the mouth and the saliva aren't effective or very effective. They get it down to the gut, and the stomach acid, it's minimal. So the food's not getting broken down in the gut like it's supposed to. So then we're sending whole foods basically into the small intestine. And the small intestine can't handle things that haven't been broken down and partially digested. So this impairs the absorption of iron, calcium, magnesium, vitamin B12, among other things. Check that thyroid and encourage people to talk with their doctor about not only testing T4, free T4, but also testing free T3, TSH, and reverse T3. What is reverse T3? Reverse T3 is the enzyme that breaks down T3. So T4 is released, and it's broken down because our body can't use that. It's broken down to make T3, which our body can use. Reverse T3 is sent out to clean up any T3 that our body doesn't use. So it basically, it cleans it up. If you've got too much reverse T3, which actually happens under stress, it may break down your available T3 before you're finished using it. It's kind of like sitting at the dinner table and the wait staff comes and clears your plate before you're finished eating. You're like, hey, wait up. I ain't finished with that yet. Well, that's what happens when we have too much reverse T3. You can also have too little, but it is important to look at all of those to figure out how the thyroid system is working. It's not just one hormone. It's not just one chemical. It's a whole system. Nutrient deficiencies impact inflammation, irritability, cognition, and blood sugar regulation because when we have too much reactive oxygen species, oxidative stress, junk, byproducts of living, whatever you want to call it, when you have too much of that build up in your system, then it causes inflammation. Inflammation is perceived by your brain as stressful, which triggers the stress response, which makes us more irritable. When we're more irritable, when our stress response is kicked off, we're not using our thinking mind. We are staying in our fight or flight mind. We are staying in our emotional-based mind. So our cognition gets worse. Our memory, our body's not diverting energy for memory and learning and organizing and stuff. Additionally, when our stress response is active, we are regularly dumping blood sugar. Blood sugar is what our body uses for the short-term fight or flee. So when your body perceives a threat, you get this bolus of blood sugar, so you have the energy to sprint away from the hungry lion. So let's talk about some of these nutrients. And we are not going to be able to, quote, diagnose what nutrients are adequate and deficient in people. But it's important just to be aware of these things. And if you think that you've got an older adult with some of these symptoms, then encourage them to talk with their doctor and think about, are they eating well? One of the causes, besides circadian rhythm disruption, one of the most common causes of irritability and frailty and wasting in older adults is inadequate nutrition. Even if they're eating well, if they're not absorbing it, it's not doing any good. So vitamin B12, if they've got reduced gastric acid, so if they're hypothyroid, or if they're taking medications to reduce their gastric acid, then they're not going to absorb B12 as well. Now, it's that Goldilocks principle. You don't want too little, you don't want too much, you got to have just the right amount of gastric acid. Deficiency in vitamin B12 can cause anemia, neuropathy, so pain or tingling or numbness in the fingers, in the toes, cognitive decline, and mood changes. Vitamin B6 or peroxidine declines in absorption and metabolism with age. It's just one of those things that we need more of as we age. Deficiency leads to anemia, neuropathy, irritability, and immune dysfunction. Folate, vitamin B9, is poorly absorbed when there's poor diet, alcohol use, or if they're on certain medications. So there are some people that don't naturally process folate very well, but that's a whole different issue. Encouraging them to eat a healthy diet, they're going to get enough B vitamins. But lack of folate in older adults can lead to anemia, cognitive impairment, and increased cardiovascular risk. Vitamin C. A lot of older adults don't eat enough fruits and vegetables because they're too high in fiber, or the fruits and vegetables they eat are cooked to death. The more you cook them, the fewer nutrients they have. The brighter the color, the more nutrients they have. When you are being served a plate of green beans and they're just kind of this grayish, greenish color, they may taste wonderful and be steeped in bacon grease, but they're probably not full of very, very many vitamins and minerals anymore because all that's been cooked out. And older adults have difficulty chewing. So one of the things they do when they start having difficulty chewing some of these vegetables, these high fiber foods, is they cook them. They're like, that'll make it softer and easier to eat. Well, yes, it does. That's true. But there's a compromise because, yes, you can eat it now, so you're getting some, but if you overcook it, you're depleting the nutrient value. Steamed is best, but again, a lot of older adults can't handle may not even be able to handle in their gut the fiber from a lot of these, especially if they haven't had fiber for a while. Don't encourage them to suddenly start eating a ton of fruits and vegetables high in fiber because that'll create all kinds of problems. Work with your dietitian and their doctor to gradually increase their intake of foods that have vitamin C. Did you know white potatoes are high in vitamin C? I was like, score. I love white potatoes. But anyway, you have to bake those. And so when you bake them, you lose some of the vitamin C. But I still hold to the fact that it's got some. When we don't have enough vitamin C, our immune system's impaired, our wound healing's impaired, our antioxidant defense is impaired, and our collagen formation is impaired. So older adults, our skin thins as we age anyway, and we start having slower wound healing anyway. Add to that nutrient deficiencies and low vitamin C. Collagen helps form our skin. If we have low collagen formation and we have slower wound healing, we're going to have a problem. Vitamin C is in most multivitamins. And again, if you're eating a colorful diet, you're probably getting plenty. But that is between the patient and their doctor. Vitamin D, the sunlight vitamin. Gotta love it. But you know what? Most older adults are not going to get enough vitamin D from the sun. Most younger adults don't get enough vitamin D from the sun either because we cover up or we put all kinds of sunscreen on. And yes, I understand we need to do that to prevent skin cancer. There's a whole thing about that. But the fact remains that low vitamin D is strongly associated with depression, fatigue, dry skin, and inflammation. So when people are vitamin D deficient, it causes all kinds of problems. Lots of people, most people, like 80% of people during the winter months are vitamin D deficient because they're not getting enough from their food and they're not getting hardly any sunlight and the sunlight they get is far less in vitamin D. I grew up in Florida, so, for a while, the parts in the year, we were able to get a fair amount of vitamin D. As we age and our skin thins, we become less able to convert sunlight to vitamin D. So if we needed 30 minutes when we were younger, it may take an hour and a half now. Well, you don't want to send grandma out into the sun to bake for 90 minutes. That ain't right. That ain't healthy. And I don't think her doctor would be along with it either. So we need to look at other ways. Older adults also have less renal conversion, so their kidneys can't convert the raw products into usable vitamin D as efficiently. They still do it, but it's not as efficient. And if they've got kidney disease, well, it's going to be even worse. They also don't intake as much vitamin D. Vitamin D is in milk. A lot of older adults don't drink milk. It's in some cheeses. So we want to look at what foods is the person eating that may have vitamin D in it, and how can they get it in their diet. Talking with their doctor. A lot of doctors will prescribe a vitamin D supplement, but again, that's one that you actually can develop toxic levels of. So it's important to encourage people not to think that if one is good, then 4 is better. No. Deficiency of vitamin D contributes to osteoporosis, muscle weakness, depression, inflammation, and immune system dysregulation. Vitamin D and calcium can compete with one another when they get too far out of whack. So again, something we don't want to mess with. Vitamin E is another fat-soluble vitamin, and fat-soluble vitamins are better absorbed into the body when they are consumed in the presence of some healthy fats. Now, I'm not saying you want to chug a bunch of oil with it, but vitamin E, vitamin D, vitamin A do better when they're consumed in the presence of dietary fat. A lot of older adults have inadequate intake of healthy fats, which means the vitamin E is not effectively absorbed. Deficiency worsens oxidative stress, inflammation, and cognitive decline. Calcium. Declining intake and absorption. Now, calcium's in a lot of foods we eat, especially if you eat brassicas like cabbage and broccoli and spinach. There's a lot of calcium in there. There's a lot of calcium in cheese and milk. But again, look at what the person is eating. How much are they actually consuming? Deficiencies of calcium accelerate bone loss, increase fracture risk, and impair serotonin and melatonin production. Well, earlier we learned that serotonin is made first thing in the morning. Its production ramps up first thing in the morning and declines throughout the day, and then it's broken down to make melatonin. Well, how do we break it down? Think of vitamins and minerals like spark plugs, and you've got serotonin sitting there, and it has to be broken down in the presence of calcium and iron and folate and a bunch of other zinc in order to be broken down effectively to make melatonin. So if people don't have the spark plugs, if they don't have the vitamins and minerals, then their engine is kind of dead. They may have all the gasoline and oil in the world, but if they can't spark off the chemical reaction, they're kind of screwed. Magnesium is commonly low from poor intake of magnesium-rich foods, medications like diuretics and proton pump inhibitors, stomach acid like, I can't even think of what it is. The pills you take when you've got indigestion, and reduced absorption. Deficiency contributes to muscle cramps, heart arrhythmias, insulin resistance, and inflammation. Insulin resistance is when your body doesn't respond to insulin very well, and the blood sugar, instead of going into the muscles where it's needed, stays in your bloodstream. That's not good. We don't want that. And when people don't have enough magnesium, then their body is less able to use the insulin to put the glucose into the muscle cells. Zinc, reduced intake, impaired absorption, and medication interactions all contribute to potential zinc deficiencies. Deficiency impairs taste, appetite, immunity, wound healing, memory, and cognition. Likewise, For some people, excess zinc may also impair taste and appetite. I know if I take any of the like emergency sort of things that have zinc in them, my taste buds are off for an hour or so afterwards. But so it is interesting to recognize that if somebody doesn't have enough zinc, or maybe if they've got too much, depending, it may be contributing to their inability to taste food or off tastes in food and lack of appetite. Zinc is involved in neurotransmission, so getting those signals from wherever we receive them, from the brain or from our touch or whatever, into the places where they need to be. Synaptic plasticity, that's your brain's ability to basically heal itself. When you have synaptic plasticity and you have a brain injury, your brain is able to find a workaround, basically. Your brain is able to adapt more effectively. And when you don't have enough zinc, the brain can't do that. And neurogenesis, which is something we all want. That's your body's ability to replace neurons. When we're stressed, especially when we're stressed for too long, the stress chemicals are just bathing our brain in cortisol and glutamate. So I liken stress chemicals to hot water and relaxation chemicals to cold water, just for the analogy purposes. So having your brain steeped in that hot water for too long, you start literally killing off brain cells. We see in brain scans of people who have chronic stress, they have lower volume in certain areas of their brain. They've actually lost brain cells. The beauty is, once you turn down that inflammation and turn down that stress, if the person is eating a healthy diet and stuff, you are capable of regenerating neurons. You are capable of healing your brain. Maybe not 100%, but you can make significant progress towards getting back to a good place. Zinc modulates the activity of neurotransmitters like glutamate, our stress hormone, and GABA, our relaxation hormone, which are critical for learning, memory, and relaxation. A little bit of glutamate, a little bit of cortisol, sometimes we need it. We need that energy, but we don't want to be steeping in it 24/7, 365. It's just not good. Older adults sometimes have iron deficiencies due to GI blood loss, so they can be bleeding in their gut. They can have ulcers or something they don't even know about. Older adults also, their intestinal walls are a lot more fragile, so they tear more easily. They can tear a lot more easily with significant constipation even. And it can be a life-threatening emergency. My husband's granny ended up in the hospital. She had lost nearly half of her blood volume. She was in the ICU for a couple of weeks after this incident because she had lost so much blood. Now, that's obviously an acute injury and a medical emergency. You're going to notice that. But older adults may have occasional blood in their stool and not pay attention to it. Occasional may not be bad, but it's important for them to monitor it and talk about it with their doctor because you don't know how much is actually bleeding in their gut. Sometimes people don't ingest enough iron-rich foods, which are your dark green leafy vegetables and your red meats and, kidney beans. There are a lot of things that are rich in iron, but if your older adult only eats, boiled chicken and mashed potatoes, then their nutrient profile is probably pretty poor. Deficiency of iron leads to anemia, fatigue, and cognitive impairment. I've shared with other people in other classes about a patient I worked with who was not an older adult, who presented with extreme depression. And she couldn't shake it. And she was like, I've tried the cognitive things. I just don't know what's wrong. And I'm like, when was the last time you had a visit to your doctor? And she said, I don't know, it's been a couple of years. I said, go see your doctor. Well, long story short, they actually admitted her to the hospital and put her on an iron infusion because she was so anemic. She was that anemic. And I'm not sure why she was that anemic. But once she got her iron levels up and her anemia under control, she felt markedly better. Now, she had other stuff going on in her life that was contributing to stress, but we went from being in an episode of severe major depressive disorder to mild major depressive disorder, and which seems like an oxymoron to say now that I say it out loud, but it is what it is. Selenium, lower dietary intake. Deficiency in selenium impairs antioxidant functioning, thyroid function, which in turn impacts energy. Now you notice I'm not giving you a whole bunch of foods and stuff because we cannot tell people what to eat. That is outside of our scope. That is something the dietitian has to do. That is something the doctor has to do. They can research it. And I actually have other videos on the YouTube channel that do go into detail about which foods have which nutrients in them. But ultimately, if somebody's eating a relatively healthy, not overcooked diet, they're probably getting most of what they need. Now, selenium's another one you can take too much of, get in toxic levels. Brazil nuts, my favorite nut in the whole world. Brazil nuts, one Brazil nut has like 400% of your recommended daily allowance of selenium. And if you eat too many of them, you can get really nauseous, really sick, really fast. So just kind of being aware that even some foods, if they're super high in a particular vitamin or mineral and you go hog wild on them, it can be a problem. Which explains why when you get the mixed nuts, there's usually only like 4 or 5 Brazil nuts in there. I always thought they were just being chintzy, but it was probably a legal issue because they didn't want somebody getting sick from just picking out all the Brazil nuts and eating them. But anyhow, potassium is often low if somebody's on diuretics or because they're not taking in enough foods that are high in potassium, or they have problems in their kidney functioning. Like everything else, as we age, our liver's not as efficient, our kidney's not as efficient. Doesn't mean we have kidney disease or liver disease. It just means, everything's slowing down a little bit. Deficiency in potassium increases hypertension, arrhythmias, dehydration, fatigue, and confusion. This can also indirectly contribute to social withdrawal, loss of routine, and circadian rhythm disruption. My mother-in-law went through a period where she was having leg cramps at night and found that having a banana with dinner was helpful. Bananas are high in potassium. There's a lot of foods that are high in potassium if you don't like bananas. But bananas actually have a lot of positives to them, and they're a yellow food. There aren't that many yellow foods out there. So we've been talking about nutrient deficiencies, and it is important to recognize that the whole point of that was to recognize that if your older adult is showing symptoms of irritability, cognitive decline, lethargy, let's take a look, slow wound healing, let's take a look at their diet. Let's check their sleep first and their circadian rhythms because that's almost always not great. But let's also look at what they're eating. Have them keep a food diary and then have them talk with your dietitian or with their medical provider to make sure that they are getting all of the nutrients and actually absorbing all of the nutrients that they need. Unfortunately, a lot of older adults get constipated, which contributes to a lack of appetite. When they're all backed up, when that food, the peristalsis is slowed, and that food's just sitting in the small intestine kind of rotting, you don't feel like eating. I don't blame them. They don't feel like eating. Additionally, there's a reduced sensitivity of thirst receptors, so they're not drinking as much, which means the system, if you will, is not as well lubricated. There's lower total body water. When we're hydrated, we can tent our skin and it pops right back in place. When we're dehydrated, we tent our skin and it just kind of hangs out there for a while. And you can't do it if you're hydrated enough. So no matter how many times I tent my skin, it's going to pop right back. But it's important to recognize, and that's something you can do or have your residents do, is just have them take their hand, and not hard enough to bruise themselves, but just take their hand and tent that skin on the back of their hand. And if they drop it and it goes back into place pretty well, great. That means they're probably pretty well hydrated. But if it just hangs out there like a bump in the sheets or something, may indicate they're dehydrated. As I mentioned, as we age, we get reduced kidney function. We just do. And it's a progressive thing. It's slowly progressive, but it is a progressive thing. A lot of older adults also drink caffeinated drinks at the expense of other fluids. Coke, Diet Coke, tea, whether it's plain tea or sweet tea, coffee. Very rarely do I see people ingesting decaf coffee, decaf tea. So they're drinking caffeine. Caffeine is a diuretic. Caffeine is also a stimulant, so it's going to trigger that stress response, and it's going to purge water out of the system and potentially leave the person feeling dehydrated. And there's also older adults may not drink enough and get dehydrated, or and may not move enough and get constipated because they have reduced mobility. Now, whether that means they can't move around, because as we move, it encourages everything to kind of move through, or for a lot of older adults, they have difficulty getting to the kitchen to get water and then getting to the bathroom to go pee. So they're just like, nah, it's not worth the effort. I don't have it in me to try to go through all the rigmarole to get into the kitchen and get myself some water. We need to recognize that reduced access is a big issue for, we mentioned earlier when we were talking about oral health, for brushing teeth and taking care of dentures. If people don't have access to the supplies they need, if people don't have access to healthy foods that they need or that are prepared for them. And we're going to talk about creating a safe environment in the next presentation. But we need to know that they have access to the nutritious foods and to ample, adequate water. My husband got his father this cup, and it apparently lights up when you haven't drunk from it in a particular period of time or something. So that was kind of cool, just to prompt him to drink, because he doesn't drink. He's in his 80s. His thirst receptors not so good. He doesn't think about it. And that has helped him increase his hydration, because he was struggling a lot with postural hypotension. When he would stand up from sitting or lying down, he'd feel like he was going to pass out. He increased his hydration, and that largely has stopped, which has been a blessing. Dietary factors also contribute to poor nutrition and constipation. Low fiber intake and insufficient fluid consumption lead to harder, drier stools that are difficult to pass. Now, you would think the more fiber, the harder the stool. That seems to make sense, but that's not it. When we eat fiber, especially soluble fibers, they absorb water. and they kind of like a sponge. So it actually makes the stools softer. Encouraging the intake of adequate fiber can be helpful. My stepfather used to have these little fiber cookies in his applesauce every morning. Whatever works for your people is helpful. If they decide that they're going to increase their fiber, or if you make a decision with the dietary staff to increase fiber in the overall menu, just make sure to do it slowly so they don't suddenly have, a lot of gas and bloating and constipation. And when older adults are constipated, in addition to having difficulty with some of their pelvic floor muscles and actually moving that stool out, as I mentioned earlier, their intestinal walls are a lot more fragile, so they can tear more easily. And that is terrifying when it happens, because the amount of blood can be copious and it can be a life-threatening emergency. So then after that happens once, the older adult's like, I don't think I really want to poop anymore because that was awful. We may need to work with them on managing their fear about evacuating their bowels after they have an episode like that, or if they have a really painful bowel movement, because when you have that happen, then they will tend to retain. And when you retain, you're actually just going to worsen that constipation. Many drugs common in older adults, such as opioids for pain, blood pressure medications, diuretics, water pills, iron supplements, some antihistamines, the list goes on, can actually cause constipation as a side effect. Look at the older adults' medications. If they're on medications that may be contributing to dehydration, may be contributing to water loss, they may need more water. Encourage them to watch their turgor. That's what they call it with the skin tenting. That's the best way to monitor that on a day-to-day basis, and work with their doctor. If they're struggling with constipation, see their doctor. It's a medical issue, because when you're constipated, again, that food's just sitting in there kind of rotting, and they're going to feel awful. It's going to disrupt their sleep, and you're not going to effectively absorb nutrients from that food. I mean, think of it kind of like eating rotten leftovers out of the refrigerator. There's nothing in there that's going to be helpful for your system. Diseases affecting nerves, muscles, or metabolism, like Parkinson's disease, diabetes, stroke, and hypothyroid, can also impair bowel function. Hypothyroid, remember we said as gonadal hormones go down, we often see older adults start to develop some level of hypothyroid. Symptoms of hypothyroid: hair loss, dry skin, low energy, and constipation, in addition to low mood. So hypothyroidism is something I always want to rule out in people that I work with that have symptoms of depression. Chronic stress, regardless of age, can contribute to dysfunction in the system and the development of hypothyroid and something called polycystic ovarian syndrome. But again, I digress. So paying attention to these things and recognizing that whether the disease itself, the chronic condition itself, is contributing to problems in bowel function, and helping the person advocate for themselves with their doctor. For example, if they've got Parkinson's, we know Parkinson's is progressive. So you may notice that in the early days, in the early stages, they have really good days. And then sometimes they have really bad days. And we want to look at what triggered that really bad day. Or if we're just talking about bowel function, they may have no problem with their bowels a lot of the time, and then something happens and everything sort of seizes up. Looking to see if there was a trigger the day before or the couple of days before that may have contributed to a worsening of symptoms. And there's age-related changes in bowel and pelvic floor muscle functioning, which can affect the ability to pass stool. There are exercises that people can do. There are machines that can stimulate those muscles in order to help people regain some of their urinary continence. And there are things that a physical therapist can work with an older adult to help them more effectively move their bowels and manage their pelvic floor muscles so they're not retaining, or likewise so they're not having problems holding their bowels or holding their urine. For a lot of adults, when they get to the point, or if they get to the point that they are not able to manage their bladder or bowel function, that is a huge grief moment. That's a huge trauma moment where they're like, it hits them that they're aging. And there's a lot of grief. There can be a lot of anger. There can be a lot of irritability that comes with that. So if you see a sudden change in the mood of your older adult, one of the things we want to consider is, where's this anger coming from? Are they angry about something that's going on that they haven't told me about? Are they angry about just in general their declining independence or their declining function? Ignoring the urge to defecate or holding it because nobody's there to take them to the toilet reduces bowel sensitivity and worsens constipation. This is problematic in a lot of facilities in which staffing is minimal. And I understand you got to balance, what you can afford to keep the doors open and, what you can actually do. But it can be especially problematic if you've got a lot of people who need assistance getting to the toilet, especially right after meals, and working with staff to determine how can we most effectively do this. Do we need to have them eat in shifts? So instead of the entire facility eating at noon, we have some people eat at 11, some people eat at 12, some people eat at 1. So we're not trying to manage 30 people at once. There are a lot of different ways to brainstorm it, but it can become a challenge. And I've seen firsthand where residents can get very agitated if they need to go to the bathroom and there's nobody there to take them. So stress, circadian rhythm disruption, and constipation are closely interlinked through the physical, hormonal, and behavioral pathways. As people get stressed, as they don't sleep well, not sleeping well increases stress, which worsens how they sleep. All that increases inflammation, may reduce thyroid functioning, and may reduce gut motility. Stress can directly impact gut function. When the stress response is activated, the body releases hormones like adrenaline and cortisol, which divert blood flow away from the intestines, slowing GI movement and causing constipation. Now, for some people, when they get stressed, it just goes right through them. But in general, when the stress response is activated, the body diverts blood to what's needed to fight or flee, which, the legs and everything else, not the intestines. Chronic stress also causes increased intestinal permeability and inflammation, and a possible reduction of healthy gut bacteria, which may disrupt normal bowel movements. We have a whole community, a whole population, microbiome as they call it, in our gut, in our stomach, as well as in our intestines, that break down food and make what we need. We have one crew, if you will, that's there when we're relaxed and healthy and everything's going well. We have another crew that comes in when we're stressed. They're two different crews. If the stressed crew stays in for too long, then we start seeing the development and proliferation of the unhealthy gut bacteria, which is a problem and can lead to that inflammation and disruption of normal bowel movements. The intestinal permeability is also an interesting thing because they've shown that as we get stressed, a lot of things happen chemically and with the microbiome, but the mucus lining of the intestine actually becomes thinner. It's there to keep the junk, to keep the crap where it's supposed to be very blunt about it. When that 5-HT mucus starts thinning out, then it's easier for the pathogens, the stuff that's in your intestines, to leak through the cell junctions and get into your body, which contributes to inflammation. And you can read all about leaky gut. And again, I've got a video on it, but we do know that it exists. They argued about it for years and years, but over the past 8 to 10 years, they finally started acknowledging it in the research literature that yes, this actually does happen. And intestinal permeability, just think about it. You want to keep that stuff sequestered. You don't want it oozing out into your body. Stress often also leads to poor lifestyle choices like unhealthy eating, lack of exercise, and dehydration, which worsen constipation. It's a vicious cycle. When people get constipated, they don't feel well. They feel bloated. They don't want to move. They don't want to walk, when walking is probably the very best thing in the world for them. Now, not all people can walk. I get it. Movement can be helpful. Work with a physical therapist to identify what can they do. Chair Tai Chi, chair yoga. What can they do? Especially what activities can they do that will work their core muscles. When you're working these core muscles, it is increasing the body in sort of manually pushing stuff through. So movement is important, and schedules are important. A lot of people will defecate at the same time each day. That's part of those circadian rhythms. And if their circadian rhythms are off, then guess what else may not happen? The GI system has its own circadian rhythm. Now, it does link up with all of ours, but it is impacted by the circadian rhythm. Bowel activity peaks in the morning and is less active at night when cortisol is low and melatonin is high. So we want people to have that serotonin and cortisol to peak in the morning, have their blood sugar, their body is more insulin sensitive first thing in the morning. Everything is firing in all cylinders and ready to go. Think about it this way. The cleaning crew has gone through the body and cleaned out all that oxidative stress and junk, and now it's time to dump it. And for a lot of people, they think that they need a cup of coffee or two in the morning to jumpstart their colon. But a lot of times, if they regulate their circadian rhythms, that's going to happen naturally because cortisol is already naturally high first thing in the morning. It just needs to get the cue that, hey, we're awake. Disruption of circadian rhythms alters normal gut motility, secretion, and absorption, contributing to constipation, poor nutrient absorption, which contribute to inflammation, irritability, and cognitive decline. I told you at the beginning of the day today, I was going to say that like 50 times, so I warned you. But the point is, or the beauty of it is, there are so many different things that we can look at. And I want you to think of it like a woven blanket. And I used to crochet a lot. And I can tell you, as soon as you break one of those stitches and it starts unraveling, the whole blanket is eventually going to unravel. It doesn't matter where you start. So think of stress like a crocheted blanket. Wherever you start making positive changes for that individual, It's going to start unraveling that blanket and taking the weight, the oppressiveness of the dysfunction off of them. Stress can disrupt circadian rhythms, which alter hormone rhythms, including cortisol, melatonin, hormones, and neurotransmitters. This creates a feedback loop where circadian rhythms worsen stress, and both together amplify digestive problems. Sleep deprivation leads to elevated cortisol. Remember, we talked earlier about the fact that when we are not adequately rested, our body perceives that as a threat. Our brain says, hey, you are not ready to take on that hungry lion that may be out there getting ready to chase you, because you've still got adenosine in your brain and you've still got oxidative stress that hasn't been completely cleared out. We ain't ready to take on the world yet. So the brain registers that as you're vulnerable and triggers the stress response. So when we don't get good sleep, we have increased cortisol, which increases inflammation because we get too much cortisol. Even if that cortisol is spiking first thing in the morning, if you're spiking way over where you're supposed to be, that's not good. All of this impacts gut health and motility. Dehydration triggers stress responses, raises cortisol, and lowers happy chemical production, disrupting sleep, mood, and cognitive functioning. When you are 1% dehydrated, you don't really realize it, but you are already starting to have impairments in your reaction time. By the time you are 3% dehydrated, research has shown, you are cognitively and reaction time at the equivalent of somebody who is legally drunk. Let that sink in for a second. We're talking about hydration. Huh? How does hydration do that? It does. Our body is 80% water, and we need water, these electrical signals and gastric stuff travel through fluid-based environments, and we don't have enough fluid, stuff just kind of shorts out, for lack of a more clinical explanation. So we need to make sure that people are hydrated. And that's true for your staff, for yourself, everybody, not just older adults. But older adults are so much more at risk of dehydration because their thirst receptors are kind of on the fritz. Constipation, as we know, causes physical discomfort, which impairs concentration, sleep, and social engagement. People feeling unwell often withdraw socially, further worsening mental health and self-care. We know that one of the most common methods of cognitive stimulation and cognitive activity in older adults is socialization. So if they withdraw and they don't want to be around people and they're, just sitting in their room watching television or watching the birds, they're not using their brain. They're not stimulating their brain, which is a problem. And we're going to start seeing increased cognitive decline. Your brain is not a muscle, but think of it like one. And we need to exercise our brains every single day. And preferably multiple times every single day for little bits and pieces, and switch it up. So sometimes it's numbers, like I do Sudoku. Sometimes it's words, like Scrabble. Sometimes it's art. For me, my art is gardening or cooking because I can't draw to save my life. But whatever. Finding activities that people like to do that trigger different areas of their brain, or even going to an art museum or looking at a picture book that has and learning about different paintings and stuff. There's a lot of things you can do. Don't underestimate the power of the library. For a lot of older adults, the library is a wonderful place to go explore because it's safe, it's cool, it's quiet. People aren't running around like crazy. For one, it's free for two. But even if your older adults or your patients can't get to the library or don't want to get to the library for whatever reason, it's important to remember that you can go there and check out books. And there are a lot of books, like reminiscing on the 1950s. Oh my gosh, people who are older, even those without dementia or cognitive decline, that can bring up happy memories. That can increase their oxytocin. That can stimulate their brain because they're thinking about a time when. The emphasis on their thinking. So we want to increase that cognitive stimulation. Dehydration disrupts electrolyte balance and neurotransmitter production, which impair cognitive function and can lead to mental fatigue and brain fog. When you're not getting enough hydration, as I mentioned earlier, 1%, you're starting to be impaired. 3%, you're at the level of somebody who's legally drunk. So let's get some water in people. Pain from constipation increases associated issues and is associated with increased fatigue, stress, and inflammation. As people become dehydrated, as I mentioned, some of those signals don't function as well. And people and neurotransmitter production, including dopamine and other motivating neurotransmitters, they start to not be processed or used as effectively. So people start to feel more tired, more sluggish. And it reflects, I feel kind of like whatever's going on inside of me. If my insides are going, just chugging along, then I'm probably going to feel like I'm chugging along. If my insides feel like it's sluggish and trudging, you know what? That's probably what I'm going to feel like energetically. Hormonal changes caused by dehydration lower dopamine, serotonin, and oxytocin, increase irritability, sadness, and exhaustion. If you've worked with people, and we tend to talk about this more with older adults and young children, but it happens in everybody, no matter what your age. When you get constipated, when people get constipated, a lot of times it tends to cause irritability and frustration and headaches even. So we want to note that constipation is a trigger for irritability. So people can recognize maybe it's not just suck it up and be nice. It is, there's something going on that's triggering this emotional reaction. Our body's trying to communicate something to us through our emotions. So what do? Reduce caffeine, especially at night, in order to avoid the diuretic effect and in order to ensure circadian rhythms stay stable. Increase fluid-rich foods, whatever that looks like, whether it's smoothies or bananas or avocados, foods that are juicy or at least soft and, have a high fluid content. Suggest flavored water. Try different flavors. You can get those little pitchers now that have the tube in the middle that you can put limes in, lemons in, cucumbers in, avocados in, whatever you want to put in it to infuse the water with that flavor. You can also get freeze-dried or dehydrated, I don't know what it's actually called, juices. I have orange downstairs right now, and it is basically just crystallized freeze-dried orange juice that I can add to my water. So I can take it with me wherever I go, and I don't have to worry about drinking something that has aspartame in it. I don't have to worry about drinking something that has caffeine in it or sugar in it. But I also don't have to drink plain water, and that can be helpful. Encourage them to increase physical activity, whatever that looks like for them. For some people, they find it helpful, even if they're just sitting, to sit up straight. Now, your abdominal muscles connect your rib cage to your pelvis. So the whole goal of them is to crunch those together. And some older adults are willing, able, and find it helpful to just sit and do seat crunches. And is it as good as other movement? No, but it's working those core muscles and it may help move some stuff through. that is something that they can talk about with their physical therapist or the recreation therapist. Maintain circadian rhythms. Ensure easy access to a toilet. If it is a challenge for them to get to a toilet, then they're probably going to retain because it's just too much of a hassle. If they go to the toilet and they can't get off and they've got to wait for an hour for somebody to come help them off the toilet, again, they're probably going to retain. And neither one of those is a good situation. So setting up people to be able to evacuate their bowels and in a way that is effective for them is really important. Now, it may be, if you're in a really busy facility, that you can't take them back to their room and their bathroom every time they need to use the bathroom. But there may be a community bathroom or public bathroom that you can take them to. So once they're finished, they can let you know, and you can immediately get them off the commode so they're not sitting there for an hour going, is anybody going to answer my nurse call? Unfortunately, it happens a lot of times due to understaffing. And I know the staff are doing the best that they can. They are working their butts off. I'm not saying anything different. However, when you've got 2 staff and 65 residents, there are times when there can be where it can be challenging to manage everybody in a timely fashion. So that is one suggestion that has worked for some places, to have in the office where the monitoring staff sits or the recreation or community somebody sits, to have a bathroom in there that they can wheel people into who aren't able to transfer themselves to the toilet and back off the toilet. If the person needs assistance toileting, explore comfort with their caregiver. If they feel embarrassed with their caregiver, or if the caregiver that helps them toilet is too rough with them, they may retain because they are trying to avoid feeling uncomfortable. If their caregiver, the person who normally helps toilet them, is off that day and there's a new person, residents may retain because they're not used to this new person and they're not comfortable going to the bathroom and having this new person help them with that activity. Make sure that they're comfortable. Work with caregivers to facilitate a rapport with individuals, preferably prior to putting them on the commode. So that's not the first time that they're meeting the person is, hey, I'm here, let me help you out. It's better if they can introduce themselves ahead of time. Try not to encourage excessive fluid intake late in the day. Don't have a mock cocktails party at 7 o'clock in the evening and start encouraging people to drink a bunch of fluids. That's not going to be good. It's going to set everybody up to have a bad night. And when people aren't getting enough sleep or their circadian rhythms are disrupted, guess what increases? Sundowning. Sundowning is much worse in people who have imbalanced or unregulated circadian rhythms. So that in and of itself may be a motivation to make sure that your people are regulating their circadian rhythms. Address urinary tract issues or issues with catheters that may make people want to reduce their fluid consumption. If they are having pain with urination, if they are getting frequent urinary infections, if they have catheters that are painful, there are a lot of reasons. People may not want to urinate, which means they're not going to want to drink fluid. My mother had bladder cancer, and it was very, very painful for her to, as her bladder would fill up, that was painful, and then urinating was excruciating. So she quit drinking just about anything towards the end. make sure to have the person work with their doctor to address any of these issues. As I mentioned earlier, more than 30% of people who show up with symptoms of delirium in emergency rooms actually have a urinary tract infection. And that's important to recognize. If they're having frequent urinary tract issues, then they may not want to drink water because it's like, well, when I drink, I wet myself, and then, all that moisture causes a UTI. So yeah, I don't want to do it. Well, no, we want to get you to drink. We just need to figure out what types of supplies you need in order to make sure that everything stays dry. Because what I'm hearing is what you're using right now ain't working. And reduced fluid consumption will contribute to constipation. Sometimes people just refuse to eat, and they're not being difficult. As people are, especially those in hospice and those who are winding down, they may lose their appetite, and that is a natural process. What we're talking about is people who aren't in that category, who they don't want to eat. They're not hungry. They may not be able to smell. So what can we do? What foods will help stimulate your appetite? And encouraging them to smell those. I know my dogs have this dog food right now that is lamb-based. And for some reason, I cannot stand the smell of lamb. It makes me physically ill. So I don't want to be smelling that before I'm trying to eat, because I'm like, And older adults may have similar issues with particular smells, and it may be something that doesn't even occur to you. Like they don't like the smell of asparagus or hamburgers. I can't imagine. But for some people, it may just not work for them. So talk with them about what smells would stimulate their appetite. Explore any dental issues. Are they having pain with chewing? Are their dentures not fitting right? Maybe not painful, but they're just not fitting the way they're supposed to. When they eat, are they having gastric reflux? And so they get really bad acid indigestion. Well, that'll make anybody not want to eat. And are they having swallowing issues because of dementia, because of changes that happen in the advanced stages of dementia, or because of dry mouth? All of these things we can examine, we can explore. And also remember the taste buds, sweet and salty, they're on the fritz. So all we've got is sour and bitter. And most people don't want to suck a lemon all day long. Finding things that do appeal to their sense of taste and smell will be very important. If they're not thirsty, all right, well, we can't force them to drink, but we need to educate them on why drinking is important to stay hydrated, to to improve cognitive functioning, to improve bowel function, and to improve balance. Because remember, if you start getting too dehydrated, you can start having postural hypotension. So when you stand up, you get really dizzy. Staying hydrated can help. Now, that's not the only cause of postural hypotension, but it is one of them. Work with the adult to identify strategies that they're good with to increase nutritious intake. What sounds good to you? What are you willing to do? In assisted living facilities where people are still able to, they have a fridge and stuff, they may decide that they want to make smoothies. And that's okay. They can even add like psyllium powder to their smoothies to increase the fiber content. So they're getting fiber, they're getting antioxidants, and they're varying what they're ingesting. That is the individual's choice, but that is one thing that they may be willing to experiment with. Same thing with water. Have them experiment with different flavors of water, whether they like water super cold or cool or maybe even warm. I'm not big on warm water, but maybe some people are. An occupational therapist can help, and I know it's kind of odd, it says occupational, but they can help with issues that involve chewing, swallowing, eating, using any of these fine motor muscles. Many issues with mood, worsening of chronic conditions, and cognitive decline may be associated with poor nutrition, dehydration, or constipation. Again, think about yourself. When you're dehydrated and constipated, how does it affect your energy? How does it affect your mood? How does it affect your sleep? It affects all pieces of our life. How does it affect how much you want to interface with other people? Really? So the same is true for older adults. They just get constipated easier, but they're still human. We want to educate the older adult not only about what to do, but how it will help reduce their pain, improve their thinking, and possibly mood, because these are more potent motivators for them than, number one, than just do it because it'll keep you healthier. Tell me specifically why I care. Tell me specifically why I care. Are there any questions about nutrition and older adults? Now, we covered nutrition a little bit in every segment so far, and there are a lot of different tips and tools, making sure their oral health is adequate, because that's going to impair or affect their ability to break down foods and absorb nutrients, making sure they're hydrated, maintaining their circadian rhythms, making sure that they're getting good quality sleep. All of those are pretty straightforward, healthy lifestyle behaviors. Work with your dietitian if you're in a facility. Work with the dietitian to identify or to make sure that the older adults are getting plenty of omega-3s and they're getting a really good balanced diet. If you're working with somebody who is aging in place, it's important to look at their meals. And Meals on Wheels is a blessing. It brings food to people, don't get me wrong. But some of the Meals on Wheels programs bring by foods that are not enough to sustain a person calorically. Not that they're necessarily supposed to be, but some people, that's the only food they get is what Meals on Wheels brings by. So making sure that they're getting enough calories in their body, and the doctor can tell you what that is. But also just look at the plate. And if the plate of food that they're eating is, kind of green and white, and that's it, or a piece of meat, potatoes, a roll, and a little bit of green beans or something, they're not getting a lot of antioxidants. The goal is to have 3 colorful foods on the plate at every meal: green, yellow, orange, red, blue, and white or brown. So you have your potatoes and your grains, and then your meat. But if you've got 3 colors on your plate, you're probably eating a really good diet. And that is so important. If the body factory is functioning, everything else is just going to be plugging